Hello and welcome to the Next in Our Alphabet series, and today is D for diabetes. Now, while this is not strictly a foot condition or complaint, it very much influences the feet if you do have diabetes. It is estimated that 10% of people with diabetes will at some point develop a foot ulcer. And of all the lower limb amputations done on the NHS due to diabetes, 80% of these have been preceded by a diabetic foot ulcer. Now, it is estimated that of these amputations, 80 to 85% can be prevented by early intervention when it comes to podiatric care. Now, how does it affect the feet? Well, it affects the blood vessels. It affects the supply of blood to the feet by forming plaques in those vessels and reducing the blood flow. And this can lead to things like cramps in the calves, loss of hair on the legs and the feet, a smooth shiny skin, pale complexion, a change in colour to the skin condition, thickened nails, or wounds and sores that aren't healing properly. It can also affect the nerves in the feet, and you can get sensory and peripheral neuropathy, and this can present in things like pins and needles, numbness, tingling, burning pain especially at night, and loss of temperature sensation and hypersensitivity to things that shouldn't be particularly painful but do feel very painful. Now, due to these problems, you may not feel a wound on the skin, you may not feel it if you cut it or stand on something, graze it, or rub a blister into your skin. And due to the increased blood sugars with diabetes, your immune system is a little bit damaged. You're not fighting off infections quite as well, and wounds are harder to heal with the peripheral vascular disease as well. So this does increase your risk of bacterial, fungal and yeast infections of the skin and the nails. What can you do if you're a diabetic and you want to look after your feet? Well, check your feet every single day. Make sure you're looking between the toes, around the heels, on the soles of the feet, everywhere, corners of nails, looking for anything that might be swollen, anything red, or any colour changes in the skin, cuts or blisters that you haven't noticed, painful areas or areas that should be painful by the looks of them but aren't. They're a warning sign as well. Fluid coming out of wounds or wounds that have been there a long time and aren't healing. Now, you should be washing your feet every single day and making sure you dry thoroughly between the toes and moisturising them every single day as well to make sure that dry skin condition that can be associated with diabetes doesn't lead to cracks in the skin. Never go barefoot, and make sure your shoes are comfortable, well fitting, they're not too tight and they're not worn anywhere that could cause rubbing on your feet. And do make sure you cut your nails carefully, cut to the shape of the toe, don't leave corners that could dig into the other toes. Now, what do we do as podiatrists? Well, we check your feet thoroughly. We check the circulation, we check the sensation, and we have equipment that we use to do that, to be able to measure it, to detect any change in sensation or circulation. We look for deformities, so any bony deformities or any wounds that you haven't spotted. And we check for potential problem sites, like areas that get hard skin, corns, rubbing, anything like that. We can advise you on your general foot health. Most people are capable of looking after their feet quite well. They just need to be pointed in the right direction. And we will treat corns, calluses, verrucas, toenails, anything that you're not capable or don't feel confident managing, we will treat that for you as well. And as I said, early intervention in any foot problems with diabetes is essential to causing a good long foot health.